Hi, my name is Dr. Anila Kamil. You can call me an international medical graduate or an internationally educated health professional. So, the idea of uploading this presentation today is because there's a lot of hue and cry in the news that there is an acute shortage of healthcare professionals in Ontario, and the emergency departments are shutting down because of lack of staff. But we have thousands of internationally trained health professionals, international medical graduates who took the initiative to come to Canada. They brought all their life savings and invested their money in getting a decent house for their families. And when they were on their way to Canada, they had this this idea in their head that we are highly skilled migrants. But when they reach here, especially from the developing world, third world countries, even though they have completed their medical education from prestigious institutes and they collected all their credentials, got them verified through the ECFMG, got their credentials stored in physiciansapply.ca. And very soon after landing in Canada, they realized that Canada is a beautiful country, people are very friendly, and it's a beautiful place to live. But the highly skilled portion gets, just gets chipped off, and they are just an immigrant, and they have invested with all their savings into property, and there they are. Wherever they go for job, they are told that you do not have Canadian experience. Then they start joining different courses and pass the exams. And, we need this paper-like thing called currency to run our daily business, like pay the mortgage, pay the utility bills, eat and dress up, like the basic rights of the every human. So those doctors, especially who have been working as specialists in different parts of the world, and then they reach here, their highly skilled portion gets chipped off, and they cannot get any white collar job in Canada unless they go through a series of exams. And even after passing exams, there are thousands of internationally trained migrants who are just without any job slot of a position. And my request to the regulating bodies in Canada is that if you guys think that all the hospitals and all the the teaching institutes in the developing world are not producing surgeons of good quality, their surgical skills are not good. And then we do have to appear for the English language test, which all of us clear, and that lasts only 2 years. Like after every 2 years, if you want to keep on with your struggle of being an international medical graduate, you have to appear in the academic IELTS or CASPER or OET just to, validate that you can speak English, you can understand English, although the exams that we do are also in English. Okay, so if we were not capable of understanding English, how would we pass those exams? So anyway, my request to the regulating bodies is that if you guys cannot trust on our surgical skills, then at least give us some opportunities in the primary care so that we can give consultations to patients based on the local protocols. And even in the emergency department, there's a triaging needed for different specialties. So there is a lot of potential that you can make use of. So I hope that the current struggle that has been staged by some of the organizations here, like the N4 organization, which is the Newcomer Navigation Network. And I see some news, some of the doctors even who are practicing and facing the shortage of the human resource are speaking about this topic. So that's why I also thought, without any prejudice, to upload this video. And I hope some consideration will be given for us, the international medical graduates. Thank you.